Alternate Entry Path program, sometimes known as the academic program, is offered by American Board of Medical Specialties to encourage outstanding, internationally trained and certified physicians, also known as IMGs, to become productive members of the US system. Here is the good news. This pathway exists for anesthesiology, radiology, general surgery, thoracic surgery where cardiovascular surgeons can participate, and obstetrics and gynecology. How do I know this? Because I trained from India and Canada and then became certified through the alternate entry path in anesthesiology. Now this video is based on my experience in anesthesiology, although some of the principles may be applicable to other specialties. If you're new here, I'm Dr. Rajiv Iyer, an Associate Professor of Anesthesiology at University of Pennsylvania in Philadelphia. My previous video and a blog post on this topic generated many questions. I have taken these and I have answered this in this video. Make sure you watch till the end, as you will find some important tips and resources throughout the video to make you successful in this pathway. My goal is to share all I know so you benefit from this if you want to move to the USA as an international medical graduate or an IMG. Let's get to the first question. This question is from Pawan CS, who says, "Thanks for an amazing video, Dr. Iyer." Thank you. I'm an anesthesiologist with about 15 years experience in India and United Kingdom. I have passed USMLE steps and ECFMG certified. I would like to get your valuable opinion regarding the career path ideal for me. I have a green card. Well, Pawan, the positive thing is that you have a vast experience of the Indian and the UK system. The green card is helpful, but does not make or break the offer. If you do not have a green card, that is not a problem, as the hospitals typically sponsor a visa. Regarding your career path question, if you wish to be eligible to become board certified in the USA, you have to enter the US system through one of the below pathways. Number one is anesthesia residency. This is the most common route. Most people I know have used this route. They've used the fellowship as a US experience to be competitive for the residency application and have been successful in matching into reputed programs. Now, how this happens is people enter into fellowship as an IMG after residency outside the USA, use this fellowship experience, and then apply for residency programs, and they become competitive in terms of matching. The second option is American Board of Anesthesiology Alternate Entry Path Program. This is offered for outstanding and exceptional anesthesiologists. With this pathway, you enter the system as a fellow or faculty or both, depending on your previous accomplishments. This is a 4-year program, and following successful completion, you become eligible to be board certified by the American Board of Anesthesiology. The next question is from Himanshu Chaudhary, who says, "I heard matching in residency becomes extremely easy after 3 to 4 years of fellowship, and residency years are reduced to just 1 to 2 years. Does multiple fellowships make residency matching easier, in other words?" Now, here's what I'm going to say. It may seem logical that once you have multiple fellowship, this increases clinical experience and makes residency matching easier. However, this can actually be a double-edged sword. What I mean by that is, the interviewer during your matching program may ask questions like, "Why did you not apply for residency earlier? What made you do so many fellowships?" and many other questions. The next question is from Dr. Snigdha Bellapukonda. "How much are we paid for research fellowship in the AEP pathway?" Well, first of all, I'm going to make this clear again. The Alternate Entry Path Program, or the AEP program, is a 4-year program formally approved by the American Board of Anesthesiology. During these 4 years, the time can be split between a fellowship or a consultant or both. I use the terms consultant, faculty, attending interchangeably. I don't want you to get hung up on these terms, but I want you to see the bigger picture. Now, the pay during research fellowship is based on the negotiation between you and the hospital who is hiring you. For the alternate entry path, the hospital hiring you will be investing a considerable amount of time and effort. you will not be in a strong negotiable position in terms of salary when you're starting out. However, here is the good news. I have to give you some numbers because you asked me a question. Here is the salary set forth by National Institute of Health that the hospitals follow as a guideline. I have left this on the screen that you're seeing here and also in the description below. In my experience, this is the minimum and you're likely to get paid the same or most likely more, but not less. The hospitals also pay a benefit package that includes health insurance and other benefits, which sometimes may go up to 20% of this pay or even higher. So the effective salary will be much higher than this. So far, if you're enjoying this video, don't forget to hit that like button. And also, if you have any questions, make sure you post in the comments below. I'll try to get back to you as soon as possible. The next question is from Vishal Pai. Thank you for the video. Sure, it's my pleasure. Can you please explain what is a faculty clinician in the USA? Is a faculty clinician allowed to provide anesthesia services or is it only a teaching role? In essence, Vishal is asking, who is a faculty clinician in the USA? A faculty clinician is a doctor doing clinical care on patients, has an independent license, and is typically affiliated with a university. Now, when an anesthesiologist is hired to a hospital under the alternate entry path program, they initially start as a hospital employee. Subsequently, the person then becomes a part of a university. The hospital usually functions under this university. Now, the clinical work may not change, but the position does change to become a faculty from a hospital employee. When the person is a hospital employee, they're referred to as an anesthesiologist. But when they become a faculty, they may get a title as an assistant professor. Consultant is a term mostly used in countries other than the USA, while the same is called an attending in the USA. Since this alternate entry path is offered in hospitals which has an ACGME accredited residency or fellowship or both, there will be teaching responsibilities of the candidates to these residents and fellows. Now, this typically involves teaching in the operating room, resident lectures, fellow lectures, depending on whatever the hospital you're working in. Now, this is also the reason these hospitals are typically affiliated with a university. For people like you and me, it's beneficial because these hospitals have a strong hold in terms of sponsoring a visa and a green card. Next question is, Vishal Pai continues to ask, I want to explore my options entering through clinician educator pathway, but this requires us to be already working in the USA as a faculty clinician, it says on the ABA website. Also, while we work as a clinician educator, would we be working as a resident or an attending, especially those who have completed training from UK, Singapore, or Australia? In other words, I think Vishal is asking, is the clinician educator considered a resident or a faculty during the alternate entry path? Now, first of all, Vishal, let me make this clear. You do not have to be working in the USA to apply for the alternate entry path. When I applied and got selected, I was in Canada. Now, this application can be done from any country. So you don't have to stop because you're in your home country and not in the USA. The American Board of Anesthesiology in their website states that the clinician educator track is offered to candidates who have anesthesiology certification from countries that have existing training and certification systems which is similar to the USA. Now, this includes the following developed countries: Australia, New Zealand, Canada, Ireland, Singapore, South Africa, UK, Europe. Now, they also go to say the other countries are assessed on a case-by-case basis. If I read between the lines, if you're not from any of this country, it's very unlikely you would be eligible for this pathway. During the alternate entry path, in the clinician educator pathway, the candidate will function as a faculty or a fellow or maybe both, but not as a resident. Now, if you're in this pathway, you're not considered as a resident. This is also true for the research and fellowship method. Now, when you think of alternate entry path in anesthesiology, there are two ways of getting in. One is the clinician educator pathway, the other is the research and fellowship pathway. This is actually the difference between getting board certified via residency or the alternate entry path program. I hope this makes sense to you. If you have any further questions, you can always post in the comments below. Now, the bottom line is, irrespective of what country you're from, it could be Singapore, UK, India, China, your role in the alternate entry path will be that of a fellow or a faculty or both. The next question is from Atif Mohammed, who says, "Thank you for the amazing video, Dr. Iyer. It's my pleasure and I'm glad you're finding it helpful. Make sure you hit the like button on this video as well." So the question is, I'm an anesthesiologist working in India with an experience of 3+ years and also hold a green card. I have one doubt. For me to apply for the research program in the affiliated hospitals, do I need to be practicing in the USA? Or can I just apply directly to the program directors for this pathway? How can we look for vacancies in a faculty post for the alternate entry path program? Well, as I said earlier, you don't have to be in the USA to apply for this program. The alternate entry path program is offered by programs that has an ACGME accredited residency or fellowship or both. The first step is to find out the list of programs that are ACGME accredited. Now, I do have a list of all the programs along with the program director's name and their phone number. If you're interested in getting a copy of this, do leave a comment in the video below. Now, this information is publicly available. Now, this might be difficult for you to find, especially if you're not in the USA, because once you get online, you might get rerouted to various different websites. Moving on to the next questions. The question says, so staying out of United States, how can we look for vacancies in a faculty post? Is it same as applying for a clinical fellowship? Do we just need to write to program directors with our CV stating our interest to eventually enter the AEP program and ask for a faculty position? As you said in your video, we do not require USMLE for research and faculty posts in the USA. What about those who want to work initially as faculty and then enter via clinician educator pathway? Do they require USMLE? I'm not sure how you interpreted my video, but I want to make this very clear. If you want to be in the alternate entry path program, you have to complete your USMLE, because this is a very reliable way of getting a license in order to practice medicine, and I recommend you complete your USMLE as soon as possible. Now, there are 3 steps to USMLE, and you can check all this information on usmle.org. USMLE step 1 and step 2 CK will get you ECFMG certified. This is required in order for you to be hired as a fellow, because ECFMG certification will make you eligible to get a training license. Now, once you finish USMLE step 3, it will make you eligible for an independent license, which is required to work as a faculty or consultant under the alternate entry path program. I hope I have made this clear to you. I don't want you to get confused about these concepts. Bottom line, you need USMLE. If you have any questions, post in the comments below. Okay. On to your next question, which is, do we write to the program directors for the alternate entry path program and ask for a faculty position? I will say, write to the anesthesia chair. The anesthesia chair is often referred to as the head of the department in many countries. The anesthesia chair has the final decision making about hiring someone into this pathway. I don't recommend sending it to program directors alone. You could copy the program director on the email when you write it to the anesthesia chair. Well, you need not ask for a faculty position, but rather just focus on highlighting all your accomplishments and your interest to be in the alternate entry path program. The eventual position, which will be either faculty or fellow or both, will be based on your CV and what the program is interested to offer. Either way, your focus should be to get into the alternate entry path program and satisfy all the high standards set forth by the American Board of Anesthesiology. Now, when you look into the ACGME accredited program, the list can be very long. So you wouldn't know which of these programs would like to offer the alternate entry path program. These programs fall into 3 different categories. Number 1, the ACGME accredited program offers the alternate entry path. Number 2, the ACGME accredited program may not offer the alternate entry path, but they may consider if they find an outstanding candidate. And number three, the programs will never offer alternate entry path programs, even though they can, because of various reasons. Since you cannot predict which programs presently offer the alternate entry path, the application should be sent to many programs, citing your accomplishments in your CV and then expressing why you're interested in this. In my opinion, the application package should be emailed to the chair of anesthesiology with the following information. Number one, a letter of intent highlighting all your accomplishment and what makes you eligible for the alternate entry path. Number two, your CV. Your CV should be updated, nicely edited. Make sure there are no typos, grammatical mistakes, everything looks nice and clean, and then send it over. If you by any chance find a program that already has a candidate in the AEP pathway, you should consider yourself lucky. This program will be more likely to sponsor you. On to the next question. This is a question from Himanshu Chaudhary. The next question is from Nelly Diwani, who asks, would Canadian experience count in the 4 years? So 2 years of Canadian fellowship and 2 years as faculty. This is a great question. Also, can you make a video describing your path, like my path, how many years you did in Canada and as what role and so on? Well, regarding my experience, that's a topic for a different video. But now coming to your question on would Canadian experience count towards the 4 years of alternate entry path program? Unfortunately, the answer is no. Canadian experience or experience from any country outside the USA will not count towards the 4-year alternate entry path program. The alternate entry path program or the AEP program will start only after the American Board of Anesthesiology formally approves the candidate. And this is offered only in hospitals in the USA. And those hospitals that have ACGME accredited residency or fellowship or both. You cannot go to a private clinic and say, I want to do an alternate pathway. Does that make sense? Now, here's the good news. Canadian experience may help candidates to get used to the USA system as they are very similar. Now, I have worked in Canada, I have worked in USA, so I understand those systems. Also, Canadian experience may help you get an independent or full license in the USA after USMLE, as some states in the US consider the work experience in Canada in those hospitals that have the Canadian Royal College of Physicians and Surgeons accredited residency or fellowship equal to ACGME accredited training. So, your training to obtain a license can be from Canada or the US. Now, this accredited training is a mandatory requirement to obtain an independent license to work as a faculty. There are exceptions to this, but for the purpose of this video, I'm not going to confuse you with that. If you are in Canada as an IMG and are interested to know about the exceptions, whether you qualify, you can always put it in the comments below. But for majority of the audience, this may not be applicable. Alright, so the next question is from Karuna Wangtangman. Question is, in the 4-year plan, while waiting for a full license, can we be a researcher for 1 year combined with a faculty anesthesiologist for 3 years? Thanks so much for the video. Again, my pleasure. Make sure you hit the like button on this video as well. Now, the simple answer to this question is yes, it is possible. A scenario of working as a research fellow or maybe even a clinical fellow for 1 year and 3 years as faculty is definitely possible. Based on my personal experience, I have seen IMGs work as a research fellow or a clinical fellow with a training license while waiting for the full license. Once the full license is received from the state medical board, the candidate can then transition as a faculty anesthesiologist or a consultant anesthesiologist with an independent license. Now, these things are clarified by the hospital before hiring you. There is a 4-year plan that the hospital submits to the ABA, and these things should be clarified in the plan so the ABA or the American Board of Anesthesiology clearly knows what the goals are. The ABA has a very high quality of reviewing the applications. The requirements are very stringent. After all, you're entering the system without a residency in the US. Now, once the ABA is satisfied, they formally approve the candidate, and once the approval process is done, that's when the 4-year time starts. Making this video has taken quite some of my time, so I do hope you're finding value with this video. And if you did, make sure you hit that like button. Post in the comments below what stage you're in terms of coming to the USA. Alright, the next question is from Dude Mood, who says, "Hi doctor, how competitive is the alternate pathway for a UK trained graduate?" As a UK trained graduate, you're eligible in the clinician educator pathway. The competition really depends on how many applicants are there from countries that have a system similar to the USA. Each hospital can have only 4 candidates under the alternate entry path program at any given time. So it also depends on how many candidates the hospital already has that is planning to hire you. Now, the standards required by the American Board of Anesthesiology is very high. So it comes mostly about finding a hospital that can sponsor the position. Now, usually it is unlikely a candidate will be competing with other candidates. That's because of the limited pool of candidates who are eligible for the AEP pathway. But more so, it depends on how strong the candidate's background and the CV is. Alright, Dude Mood says, "Thanks a lot, Dr. Iyer. It's my pleasure. So apparently with great CV, it's achievable. Do you think having a disastrous medical school transcript with multiple failures will make it impossible to get one of these seats? Because it happened to a friend of mine in Canada. After agreeing on academic position, they were impressed with him, but after seeing his extremely bad grades, they apologized and didn't appoint him." So what I can say here is, irrespective of how the medical school was, think in your mind, how was your residency? Did you do a fellowship? How was your fellowship? Did you accomplish academically during residency or during fellowship or both? Are you well published? Do you have a lot of lectures? Have you been in a reputed academic institution in your home country or any other country outside the USA? If the answer to all this is yes, then you still have a possibility of becoming eligible to the AEP pathway. Now, in terms of why Canada refused, I can't answer for that. I have seen this happen to other candidates that I know of. But anyway, what we are talking here is the alternate entry path from American Board of Anesthesiology, which is a completely different thing. Of course, the standards set by ABA are very, very high. As a candidate, you have to be really competitive and you really have to have accomplishments and prove yourself as to how and why you're eligible for the AEP pathway. If you have any more specific questions, post in the comments below. The next question is from Spirit Wanderer, who says, "Sir, is the same alternative pathway applicable for other specialists such as neurosurgery and cardiothoracic surgery?" So the good news is there are many specialties that offer the alternate entry path. In addition to anesthesiology, which we are talking in this video, American Board of Surgery, American Board of Thoracic Surgery, American Board of Radiology, and American Board of Obstetrics and Gynecology are the other boards that I am aware of who offer an alternate entry path for IMGs. If you want the links to these important resources, do post in the comments below. And I've also left in the description below. Check them out. The next question is from Roberto Espinosa. The question is, "Hello, I'm anesthesiology with 7 years of experience, currently working in Saudi Arabia. I get my certificate as anesthesiology from Cuba, that is my home country. Can I be eligible for the anesthesia board?" So as I mentioned earlier, you're certainly eligible for the anesthesia board. The path to entry are through the traditional US residency or through the ABA alternate entry path. Good luck to you. The last one is Balbir Kumar says, "Very nice video. It's my pleasure. Thank you. I now want you to check this video that I made based on which all these questions came up. I've also left this video in the description below. I talk the different pathways about the alternate entry path in this video. As always, take care, stay safe. I will talk to you soon."